Which of the following is the first step in responding to a blood spill in the workplace? A. Put on gloves. B. Disinfect the area. C. Absorb the blood with paper towels. D. Notify the supervisor. Answer A. The first step in handling a blood spill is donning gloves to protect against exposure to blood-borne pathogens. What is the normal range for an adult's resting respiratory rate? A. 8 to 14 breaths per minute. B. 10 to 16 breaths per minute. C. 12 to 20 breaths per minute. D. 16 to 24 breaths per minute. Answer C. The normal adult respiratory rate at rest is 12 to 20 breaths per minute. Which federal act ensures patient privacy and confidentiality? A. CLIA. B. OSHA. C. HIPAA. D. ADA. Answer C. HIPAA, Health Insurance Portability and Accountability Act, ensures the confidentiality and security of healthcare information. A patient presents with a burn on their arm. What type of PPE is required for wound care? A. Gloves only. B. Gloves and face shield. C. Gloves, gown, and mask. D. Gloves and gown. Answer C. When treating open wounds, standard precautions like gloves, gown, and mask help prevent exposure to bodily fluids. Which of the following tasks is within the medical assistant's scope of practice? A. Diagnosing a condition. B. Prescribing medication. C. Performing an EKG. D. Adjusting a patient's medication dosage. Answer C. Performing diagnostic tests like EKGs is within a medical assistant's scope, diagnosing and prescribing are not. When should the code for a procedure be verified? A. After the provider signs the chart. B. Before submitting to insurance. C. During the patient encounter. D. At the time of appointment scheduling. Answer B. Verifying the procedure code before insurance submission ensures accurate billing. Which of the following would be considered a legal tort? A. Administering a vaccine without consent. B. Giving an accurate medication dosage. C. Reporting abuse. D. Documenting vital signs. Answer A. Administering treatment without consent is considered battery, which is a legal tort. Which term describes a rapid heart rate? A. Bradycardia. B. Tachycardia. C. Dyspnea. D. Hypotension. Answer B. Tachycardia refers to an abnormally high heart rate, typically over 100 bpm. Which artery is most commonly used for adult blood pressure measurement? A. Brachial. B. Carotid. C. Radial. D. Femoral. Answer A. The brachial artery is commonly used when taking blood pressure with a cuff and stethoscope. A patient refuses a procedure. What should the medical assistant do first? A. Proceed with the procedure anyway. B. Document the refusal and notify the provider. C. Discharge the patient. D. Call emergency services. Answer B. Documenting patient refusal and informing the provider respects patient autonomy and maintains proper documentation. Which of the following types of injections is administered at a 90-degree angle? A. Intradermal. B. Subcutaneous. C. Intramuscular. D. Intravenous. Answer C. Intramuscular injections are typically administered at a 90-degree angle to reach deep muscle tissue. What is the first thing a medical assistant should check when a patient arrives late for an appointment? A. Insurance coverage. B. Physician's availability. C. Patient's vital signs. D. Copay amount. Answer B. Check the provider's availability to determine if the patient can still be seen or needs rescheduling. Which of the following lab values is most important to monitor in a diabetic patient? A. Hemoglobin. B. Glucose. C. Sodium. D. Calcium. Answer B. Monitoring blood glucose levels is essential for diabetic management. Which method of temperature measurement is considered most accurate? A. Axillary. B. Oral. C. Tympanic. D. Rectal. Answer D. Rectal temperature is the most accurate as it reflects core body temperature. What document must be signed before releasing a patient's medical records to a third party? A. Consent to treat. B. HIPAA training form. C. Patient release form. D. Insurance form. Answer C. A signed patient release form is required to release medical records legally. What does the abbreviation QID mean on a prescription? A. Once daily. B. Twice a day. C. 4 times a day. D. Every hour. Answer C. QID stands for quarter die, or 4 times per day. Which of the following is a CLIA waived test? A. Pap smear. B. Manual CBC. C. Rapid strep test. D. Hematocrit. Answer C. The rapid strep test is a simple, low-risk test commonly CLIA waived for in-office use. When measuring blood pressure, what does the first sound heard represent? A. Diastolic pressure. B. Pulse pressure. C. Systolic pressure. D. Baseline pressure. Answer C. The first sound heard, Korotkoff phase I, indicates the systolic pressure. Which type of scheduling involves booking multiple patients at the same time? A. Wave. B. Stream. C. Modified wave. D. Cluster. Answer A. In wave scheduling, several patients are scheduled at the same time and seen in the order they arrive. Which of the following needle gauges is most appropriate for a venipuncture? A. 16G. B. 18G. C. 21G. D. 25G. Answer C. A 21-gauge needle is commonly used for routine venipuncture procedures. What is the proper method for cleaning the site prior to a capillary puncture? A. Dry gauze. B. Water and soap. C. Alcohol pad. D. Iodine solution. Answer C. An alcohol pad is standard for disinfecting skin before capillary puncture. A medical assistant suspects a coworker of being under the influence of drugs. What is the most appropriate action? A. Ignore it. B. Report it to the office manager. C. Confront the coworker. D. Call the police. Answer B. Concerns about safety or impairment should be reported to a supervisor, not handled personally. Which of the following is considered subjective data? A. Blood pressure. B. Heart rate. C. Patient complaint of dizziness. D. Temperature. Answer C. Subjective data refers to symptoms reported by the patient, such as feeling dizzy. What is the purpose of the chain of custody? A. Ensure equipment sterilization. B. Maintain patient confidentiality. C. Protect legal integrity of samples. D. Control infection transmission. Answer: C. Chain of custody ensures that a specimen is legally and securely tracked to avoid tampering. When should the tourniquet be released during venipuncture? A. After removing the needle. B. Before inserting the needle. C. Once blood flow is established. D. Before applying the bandage. Answer: C. Releasing the tourniquet after blood flow is established helps prevent hemoconcentration.